Pakistan is a huge country with over 220 million inhabitants, and it faces lots of issues regarding man-made and natural disasters. And these cause, of course, people to be displaced from their homes and refugees, and that's the main reason why MSF is here. The people that we work with are people living in rural areas, but also in urban informal settlements, and they can be refugees or internal displaced people. Even though medical care is widely available in Pakistan, people that are affected by earthquakes, floods or man-made disasters have of course a problem accessing it, and that's why MSF in collaboration with the health authorities looks to provide for quality medical care to the most vulnerable people. MSF started our medical activities in Pakistan in 1986, and today we work together with almost 1,600 national staff and 40 international staff to support our operations. MSF operations accelerated during the large-scale responses towards the 2005 earthquake and the 2010-2016 floods in Pakistan. MSF also intervened in the 2010 and 2013 measles and dengue outbreaks. In 2020, MSF responded to the Dadu floods and the COVID-19 outbreak. One of MSF's key priorities in Pakistan is to work on improving healthcare for mothers, children and newborns, especially as maternal mortality rates in Pakistan are really high. At some of our key facilities, MSF provides gynecological and emergency obstetric care. Examples include the Women's Hospital in Peshawar, Khyber Pakhtunkhwa, Uchlak Healthcare Facility in Quetta, District Headquarters Hospital in Chaman, Balochistan, and the District Headquarters Hospital in Dera Murad Jamali, also in Balochistan. In Peshawar, Chaman and DMJ, MSF offers neonatal care services. MSF health facilities in Balochistan also provide pre- and postnatal care facilities. These facilities are available for the local communities, but also for the Afghan refugees. In Balochistan, MSF furthermore provides support to malnourished children and mothers' health. This includes therapeutic feeding, contributing to the improvement of health care for mothers and children in this area of Balochistan. Beyond mother and child health care, hepatitis C and cutaneous leishmaniasis, MSF has recently started a multi-drug resistant tuberculosis project in Gujranwala, Punjab. Pakistan ranks 5th amongst the TB high burden countries. Most alarming is the fact that each year 15,000 patients are developing multiple drug resistance TB, and that ranks Pakistan at the 4th level worldwide. Another public health burden in Pakistan is the high prevalence of hepatitis C, and MSF focuses its programs around people suffering from this disease. MSF has stepped in to support the health authorities in Sindh to work on a decentralized model of care for hepatitis C patients in one of the largest informal settlements in Pakistan, Marcha Colony in Karachi. Surveys in Pakistan by the Department of Health in Sindh and Punjab have estimated the hepatitis C levels to be at 6.7%. Cutaneous leishmaniasis is a tropical parasitic disease which is endemic in Khyber Pakhtunkhwa and Balochistan areas of Pakistan. As this is not a common disease, affordable drugs are not available to patients in Pakistan. MSF supports patients with diagnosis and treatment for this disease in 3 locations in Quetta and 2 locations in Peshawar and 1 in Banu in Khyber Pakhtunkhwa. MSF is scaling up support to patients with leishmaniasis in satellite centers in the outskirts of Peshawar and in Banu. MSF made a first emergency response to the COVID-19 pandemic in Pakistan during the first wave in April 2020. MSF opened a 30-bed COVID isolation ward in Timagara, and we installed a screening setup in Timagara District Headquarters Hospital, which helped the community. This activity was handed over to the Department of Health in October 2020. In Balochistan's second city by population, Jaman, on the border with Afghanistan, MSF set up a 32-bed isolation ward in Qila Abdullah's District Headquarters Hospital. At the same time, MSF continued with our life-saving activities in the health centers. To ensure the safety of our patients and staff, we added protective COVID-19 measures in our facilities. Currently, in support to the health authorities, MSF is carrying out COVID-19 vaccinations in Kamari district, Karachi. Further in response to the COVID-19 outbreak, MSF has been making donations in medications, medical supplies and PPEs to Karachi, Lower Dir, Upper Chitral, Dadu, Peshawar, Swat, Quetta and Gujranwala district, directly to local health authorities or to hospitals.